All right, I want to start off giving everybody a little bit of an overview of how to get any of the Gaumard simulators working. I'm going to have everybody that has any contact with the simulators use one of the motion tablets for activating and using any of the simulators. I think this is the best utilization of the resources we have, and it protects the Surface Pro that's ultimately the master of all of the programs associated with the Gaumard simulators. So on the tablet, if it's facing you, you're going to see on your left side there's a little silver switch, and you will simply use that switch to turn the tablet on. It may take a while, and since the tablets are a little bit older, it may take a little bit of time to get them up and going, and they may have to be plugged in for them to work. So just be aware of that. But when it does finally come up, all of the tablets should have UNI. You will see UNI, and you'll see a little baby curled up in the fetal position, and you will click on UNI to activate the simulator. Okay, and sometimes that takes a little bit of effort too. You've got to use the stylus. And it may take a minute or two. Now, before I forget, right up front, just like we would be working with a patient, you need to make sure that nobody touches any of these simulators unless they have gloves on. Okay, the Surface Pro is touch driven, so it might be tough to use gloves with it, but since we're going to focus on using the tablets, it's going to be fine because we have to use the stylus, so we should glove up too, even if we're back here on the computer. So again, nobody can touch these unless they have gloved up. So they should do proper hand sanitizing and then put their gloves on and not touch any of the simulators. Their skin can actually absorb the demo medication that's included. So we don't want anything that's on anybody's skin potentially ruining the skin on the simulators. So again, please make sure that everybody gloves up when they're working with the simulators. Now, I've got Noelle that I'm working with. I'm going to bring up Noelle. Okay, when you see this Gaumard menu come up, in this case, I'm going to click on Noelle. Okay, all the Gaumard simulators, the platform looks the same that runs them. Okay, so once you learn basics on Noelle, you can transition over to Victoria or HAL. So essentially, since I'm getting ready to work with Noelle, I click on Noelle. If Quick Start Noelle isn't checked, then click Quick Start Noelle. Then I'm going to hit Start. And it may take a little while before it comes up. The other thing I will caution you too is that to get to the Gaumard site, to get to the Gaumard network, I should say, the router needs to be in close proximity to your computer. If the router is located in the Victoria lab, as I call it, then we probably are going to have to move the router to the other lab that's on the 4th floor in order for those simulators to work. So just be aware of that. Now, you'll see a blue bar go across your screen. That means it's starting to activate. So Noelle is starting to come online. Okay, now we see the full screen is available. We still don't have interaction with her yet. It's going to say please wait while communication is established. There's going to be another blue bar, go all the way across that, and there you can see it now. And that's going to indicate that she is activated. Okay. Now, I typically will use my stylus and about 2/3 of the way down click on speech. I'll use the stylus, click on speech. Then I'm going to go up here and click, in this case, pre-recorded. Okay, I just want to make sure she's fully operational. So I'm going to click something that I pre-recorded.
CPI University Medical Assistants, the best. I'll only have them treat me.
And as you could hear, Noelle said that ECPI University medical assistants are the best, and she would only have them treating her. So we know she's in fine working order when she says that.
ECPI University medical assistants are the best. I'll only have them treat me.
One of the things that the Gaumard rep told me, the reason the simulators had some aches and pains, so to say, before he tuned them all up, was they just weren't being used enough. And you'll notice their voices actually get stronger when you use them more. So that's one of the things that I can't emphasize to all the faculty, that the simulators need to be used regularly, but they also need to be used properly. All right, so we know now that she is ready to go. So what I can do is, from this particular screen, if you look in the upper left corner, there's something that they call the magic wand. Okay, it's this right here. Whoops. Okay, it's instant apply. If you click on that magic wand, then everything that you program into her happens instantly. If you don't use that, then what ends up happening is you have to program in a time that you want something to occur. Okay, so let's say I'm using her as an EKG trainer, and I don't click the magic wand, and I convert from normal sinus rhythm to a run of VTAC. It may be 5 minutes as the default when that VTAC occurs if I don't have the magic wand activated. Okay, so again, anything that I want to do, and if I want it to occur instantly, I've got to click on that instant apply, or as the Gaumard rep called it, the magic wand. Now, if you look down the side, okay, you will see there are a number of different icons, okay? And just to give you an idea of what each icon can do, this can change her eyes, for example. We can have seizures, we can have blink state, pupil dilation, pupil reaction. All of those things can be controlled by clicking the eye. Here we have airway. Airway, I can go into laryngospasms. Throat sounds can be changed. Here we click on the lungs. We can get into the breathing. I can change her lung sounds. Okay, if I want to change from normal sounds to wheezing, for example. Okay, now we're going to have wheezing. And if you scroll down here, okay, you'll see there is a little box that you can click on that says sync all sounds. When you do that, that's going to make sounds in the left lung and the right lung the same. Okay, so if I have wheezing biphasic, then when we click on that sync all sounds, both lungs are going to have the same sound. With my medical assistant, since we're still working on these things, I've not gotten too creative. I've tried to keep that basic, so typically I will sync it. And more advanced students, you could switch it up so they have to be sure and listen to both sides. Now, this little slide bar is what controls volume. Okay, typically I've been having it at max just to help our students, and then later down the road as they gain more confidence and skill, we can switch that up as well. Then I'm going to check this little green check. That will instantly apply what I just changed. Okay, if I want to go to respiratory rate, I can click on respiratory rate, and you'll see there's a little slide. Okay, I can change my rate with this slide. Whoops. Okay, I can change my rate with this slide. Okay, or if you look over here, there's a little keypad, numeric pad. I can change my rate by clicking on the box where the rate is going to be and using that arrow to get rid of any numbers, and then I can put in whatever numbers I want. Here I'm going to put, here I'm going to put in 16 breaths per minute, and then I'm going to click instant apply, the check, okay, and we're going to be at 16 respirations per minute now. Okay. I can change inspiration percent, I can change oxygen saturation, all of that I can change by simply clicking on it and then utilizing the stylus to make those changes. If I go down to EKG, okay, I can change EKG, and I have a drop-down menu, okay, of different rhythms that we can make Noel perform. Okay, I'm going to click a first degree AV block, and I'm going to add in PVCs. Okay, once I've decided that I have first degree block, I've highlighted it, I've clicked on PVCs, okay, I click that check, and now when I look, I can see in yellow I've got a first degree AV block with PVCs. My heart rate is 75 beats a minute. Okay, heart sounds can be altered as well, much like lung sounds. Okay, here I can have systolic murmur, S3, S4, aortic regurgitation, aortic stenosis, whatever the case may be. Then I can change volume as well. Okay, and if I wanted to change anything after I made the change, I'd simply click on that check. Okay, I go over here, now I check on this, that is circulation. Okay, circulation typically with my medical assistant is going to be blood pressure. Okay, we can change blood pressure again by using the scroll bar, or we can click on the numeric keypad. Okay, once we've clicked on it, okay, and let's say I want to make it 144 over 74. Okay, then I'm just going to click that arrow. Okay, so now we can see that it is 144 over 74. Okay, now I've got pulses on her, radial pulse. Okay, I've got radial pulse on both sides. Okay, we can also put blood pressure cuffs on Noel on both sides, but the simulators are a little bit different. For example, the Susie simulator that I have in the medical assisting lab, room 433, she has pulses below the waist. Okay, popliteal, femoral, pedal pulses. Whereas Noel and Victoria, because of the additional requirements to have the birthing capabilities, they don't have those pulses below the waist. Okay. Hal does not have pulses below the waist, for example. So utilizing the simulators, you know, on a regular basis and finding out what their limitations are, you know, is going to be important, because you don't want to have an assessment module set up and you want to check for peripheral vascular disease and there are no pedal pulses, for example. So again, you want to make sure that you choose the right simulator for the job. But more importantly, like I said, right now I just want to go over some basics, how we change some of the most basic functions of the simulators. Now, here are those verbal commands. I still have it on speech. Down here you'll notice I've got all of these different functions across there. Okay, virtual monitor, fetal monitor, palette, scenarios, so on and so forth. Palettes are what we can build for a specific simulation that we deem necessary. Okay, scenarios are what are already built into the simulators. Okay, there are substantial numbers of pre-created scenarios, and each one of them has a female name, Alice or Kim or Ann or whatever the case may be. Pallets, though, would be something that we create. For example, we take the Alice scenario and then add a seizure, or we could create something completely different and have advanced cardiac life support scenario where we run a code situation. Okay, where we start off with VTAC, we see increasing numbers of PVCs. The PVCs deteriorate to couplets, 3-beat runs till we start to see bursts of VTAC, and then finally VFib, and then ultimately, if the care isn't correct per ACLS guidelines, then the patient would go from VFib into asystole. They can be defibrillated. Okay, we could actually hook a defibrillator up to them and discharge if need be, or we can just mimic it using defibrillator pads and the wires, which give us the hands-off defibrillation capabilities. Okay, but again, that little gray bar across the bottom here tells us some of the different functions that we have. Now, I clicked on speech a second ago, of course, so I could make them talk. Okay, again, that's just going to be one of the functions. Here I'm going to click on, okay, since I still have speech highlighted, these are preloaded complaints. Okay, since I come from a cardiac background, I can't count how many times I heard,
like there's an elephant sitting on my chest.
Okay, it feels like there's an elephant sitting on my chest.
Feels like there's an elephant sitting on my chest.
Okay, I can change things accordingly. If I want to add a custom type, I can add that too. I can simply use the voice recorder. Okay, but for the most part, we have several different verbal commands that we can utilize. Here's confusion.
Remember. I don't remember.
Okay, and you could hear her voice got a little better the second time I clicked that button. Or if we want history, I've used cocaine today. Okay, never want to hear that in an OBGYN module, but nevertheless, it may be something that you utilize if you're talking about a high-risk female with a high-risk potential delivery as well. Okay, number. Okay, those weren't very legible when she verbally stated those numbers. And again, that's something that needs to be, again, utilize the simulator more, and their voices do get stronger. Now, a couple other things that I want to go over in this quick overview. If you'll notice down here at the bottom, there is a running tally of what is going on. This would be serving as the scribe if we were running some sort of a scenario. Okay, in this case, it's just recording what I touched on from those verbal lists of options. There's an elephant on my chest. I don't remember. Okay, I used cocaine today, various numbers. Okay, so it is going to run everything that ultimately I click on. So this would be good. We can actually, if you want to, you can actually save this. You could print it out, and you could go over the scenario, and you could use it as a grading tool. Here you see there's a file that you could ultimately put a file folder with whatever class you want to head this as, and then ultimately keep tabs on this. If you were going to have it a single healthcare provider scenario, you could grade it strictly on one student's performance. If it was a team, you could put the people in the team and critique their performance of the skill. So here you see the team option. Okay, so again, we have a lot of options that we can use. Another thing that I want to touch on is this is called the virtual monitor. Okay, and we can see that our virtual monitor in this case is giving us EKG. Okay, it's giving us arterial blood pressure, it's giving us respirations. Okay, it's giving us end-tidal CO2. Okay, all of that is represented on our virtual monitor, and so anytime we make a change, it is going to be logged on our virtual monitor. Okay. Now, we can grab that virtual monitor and stretch it out just a bit, but nevertheless, it doesn't really add a whole lot to the viewing screen. Okay, I believe now we have monitors, bedside monitors for all of the simulators that are touchscreen. And once we've kind of mastered this information, then we'll start getting into the touch screens. But more importantly, you can see everything from here. And I've used the EKG, for example, that's on the tablet screen as a tool for my medical assistants when we didn't have access to one of the monitors, so they could see a much longer version of it on the bedside monitor. Okay, but again, we can move that, drag it over just a bit. Now we also had the fetal monitor. Since this is Noelle and she can deliver, her delivery isn't quite as high tech as what Noelle is, but nevertheless we can utilize her for delivery, and we can also get fetal heart rate. Okay, we can see we've got the TOCA monitoring as well. We can also have a force curve as to how much force ends up being utilized when we have to pull the baby from the birth canal. And so again, that's something that may be useful when you're teaching labor and delivery. Again, we've got the ability, if you'll notice here, we can have turtle signs. Okay, we can make the baby present and then go back up into the birth canal. Okay, and later on I'll teach you guys how to utilize the delivery curve. Okay, I don't have a baby loaded in her right now, so I don't have anything to deliver, but more importantly, I just wanted to, you know, show you the basics on the screen with her. Okay. Obviously, this is not the most high-tech of videos, since it's just me putting it together spur of the moment, but I wanted to get something in your hands. Here we can see in the corner, I do have the bedside monitor up here on the 5th floor. I already have a blood pressure cuff calibrated on Noelle. Please, when we put a blood pressure cuff on any of the simulators, do not take it off. We have to calibrate it so it becomes accurate. If it gets removed, then we have to go through the calibration process again, and that's quite time consuming. So I don't want anybody to remove that. Reiterate that to your students, just like you do the need to wear gloves when you're working with them. Okay, here obviously I don't have her eyes open. Okay, I can change her blink rate. We can see here she can actually use a nasogastric tube. You can see the one side of her nostril, her nair, has that heavy or deeper pink color that we can utilize. She can be intubated. Here we have contact points for EKGs. Okay, I can palpate. Okay, I don't have gloves on, I know, but I can palpate her radial pulse. Okay, I can also feel on the inside of her arm up here, she can actually have blood pressures taken on both arms. Sometimes I'd have my MAs competing one arm against the other arm and see who got the best read. So again, that is very important. Okay, Victoria is a lot more complicated in terms of removing her stomach. Okay, but you'll see there are Velcro tabs that hold Noelle's stomach in place. Okay, this slide rail system is where we incorporate the delivery baby. Okay, this motor advances and pushes the baby through the birth canal. And another key thing that I have to emphasize, you must use the mineral oil to lubricate any of the simulators, both the Noelle's and Victoria. You must lubricate the neonate, you must lubricate the birth canal. You have to lubricate them. Don't worry about using too much. Okay, their skin soaks up everything, and so you will put a baby and he will just be dripping with the mineral oil in here, and then when he comes through the birth canal, it's practically dry. So after every time you perform a delivery, you have got to lube up the birth canal, lube up the baby, because if you don't, the plastic will adhere to the latex, or you'll also see in Victoria's delivery infant that it's much more advanced. It has a soft skin on it versus Noel that has the hard skin, and it will adhere and potentially tear the birth canal on Victoria. Now, you can see this tube. That tube, we can actually do caths on her. We can put fake urine in there, and so we could catheterize her. Okay, on Victoria, we can actually put blood in her as well. We have not yet done that because we're still learning her. You know, those of you that ask, hey, Carrie, do you have 15 or 20 minutes you can show me how to use Victoria? It's not an easy process, okay? I just cannot do that, okay? And again, we're still figuring out a lot of this stuff on the fly. So here we see the birth canal. We can catheter, we can insert a catheter through the urinary meatus. We can visualize it and insert it and get urine if we so choose. In Victoria, like I said, we could make her have bleeding associated with delivery. Okay. Now, again, below the waist, we do not have any pulses on Noel or Victoria or Hal, but the Susie simulator that I have in 433, she has a fully functional birth canal, but just does not have the ability to deliver. So if you all ever wanted to practice catheterizations, I would strive to guide you towards utilizing Susie versus using any of the delivery simulators. Okay, she's a lot less complicated, less could go wrong. Okay, but then again, Susie has some advantages. She has the pulses below the waist. She also has anterior and posterior breath sounds, whereas Victoria and the Noels only have anterior lung sounds. Now, we have a Hal that is very high fidelity. He's in the Victoria lab, and I actually call him Super Hal to differentiate him from the Hal that is in the other lab on 4th floor. And that high fidelity Super Hal has all the lung sounds. He can be fully intubated. He can be put on a vent. Okay, he has full resistance. So as it turns out, when I spoke with the Gaumard rep, when we were putting Hal back together, because he was up on 5th floor in the skills lab in pieces, he said he is actually more advanced than Victoria. So Victoria does have the birthing capability, but in terms of overall functions, that Super Hal is even more advanced than Victoria. So again, I want to emphasize how much the training is going to benefit everybody, because I want these simulators, now that we've worked so hard to get them fully functional, I want everybody utilizing them properly and not laying hands on them unless they have put gloves on and they fully understand what they're working with. Okay, but this is kind of an overview of Noel, basically getting to the platform itself on the tablet so everybody can activate the simulators. I have definitely seen an improvement in the skills of my medical assistants. It's given them a sense of pride to be working with the simulators. At first, when we got Victoria and I could only get in a little bit here and a little bit there, you know, they really enjoyed that. But since we've been able to utilize Noel up here on the 5th floor and Susie down there in the MA lab, you know, they've definitely taken a sense of pride in having the capability of using these on a regular basis, and I think utilized very often in the classroom setting. And as we get stronger in terms of the scenarios that we can come up with and actually apply to the classroom setting, they're going to be even stronger tools. But as it stands, we need to all at least be on the same page with how to activate the device and make sure that, you know, again, we're taking safeguards to not do any damage to them. Now, when we go to wrap up, we're going to just hit this X up here in the corner, and it's going to ask if we want to save this session report. I've not yet saved any session reports. We have not utilized a grading system, you know, because we had a scenario programmed in or anything like that. But if you do down the road, you can of course save it. You can name the scenario, put the date in, put the student in, or whatever the case may be, and you could come back and sit down with them and use that as a tool to guide them in their career in healthcare. But I do not want to save it. Okay, so I'm just going to click on it. Okay, and that brings us back to the blank screen where you can see Uni. And if I wanted to fire her up, again, just click on Uni, and then eventually the menu is going to come up that has all of the simulators on there. Hal, Victoria, Newborn Hal, Pediatric Hal. But again, any of them run off that same menu that I just showed when Uni comes up specifically for Noel. Okay, so once you learn how to use one of them, essentially you know the basics on all of them. Okay, all right.